Your messages pull at heartstrings, and appropriately so. They are what this is all about. This whole endeavor of government, industry, and it's all about patients and patients organizing. And in the days of the internet, the ability for people with very, very rare diseases to reach across, find each other, pull together across national boundaries and make things happen is absolutely phenomenal. It is, again, a uniquely American way of doing things. We get stuff done. That's one of the things that we are known for in this country. So, these are moms, and as I mentioned with Abby, the founder of Nord, moms are powerful, powerful people. And so I want to hear from them, their stories. I've spoken to each of you in advance of this, but I think that the people in the room need to hear what rare diseases and orphan drugs are all about from the people who really know, and that would be you. So, as you like.
Okay. Hi, I'm Tracy Brown, and I'm here today with my husband Ryan and our son Ian, the handsome little guy in a suit back there squirming around. We really appreciate the opportunity to share our story with you today. And before I get into Ian's story, I just wanted to mention briefly, we heard earlier that 1 in 10 Americans are affected by a rare disease. And in our family, we actually have 2. I'm going to talk about Ian, but my 7-year-old niece also has a rare disease. And she gets blood transfusions every 2.5 weeks. Her disease is called diamond black fan anemia. And she's 7. And by the time she's aged 50, she will have received about 850 blood transfusions just to keep her alive. So I just wanted to mention Amelia because she's special to me too. So our journey, I call it Rare Disease Land. Our journey into Rare Disease Land began when Ian was 10 months old, and we noticed a swollen lymph node in his groin area, and we called our pediatrician, and she said, well, I think you should go to the ER. It kind of sounds like it might be a hernia. So 9 hours later, and lots of different tests, we were sent on our way with a prescription for an antibiotic and told very nonchalantly that it could be an infection or it might be lymphoma, so follow up with your pediatrician in 10 days. Not really what you're looking for after a day like that. It didn't go away in those 10 days, so over the next 5 months, we subjected Ian to a multitude of testing, from cat scratch fever, which I didn't know was actually a real disease, to tropical diseases. And all of that didn't turn up with anything. So he had a biopsy in October of 2006, and we were finally able to figure out what we were dealing with. And it's called Langerhans cell histiocytosis, LCH for short. And it affects about 5 per million, and it's primarily children under the age of 10. With LCH, there's a certain type of white blood cell called the histiocyte that overproliferates and does damage to the surrounding tissue and bone. And in Ian's case, he had over 30 lesions in his skull and in his vertebrae, his hip bones, his rib bones, his cheek bones. And when you look at an x-ray, it's kind of like a picture of your child's skull with Swiss cheese. You see these holes. And it can also affect the internal organs and often is fatal when it does go to the internal organs. And then it can also go into the brain and cause irreversible neurocognitive problems. There is no known cause or cure for LCH. We were very fortunate in our disease to have some wonderful doctors that are working very hard. Fortunately, they don't get enough money to do that, but they're working very hard. And so we have learned that right now the best way to treat it is with chemotherapy, because it suppresses the immune system, and these are white blood cells, and so it also suppresses those overactive histiocytes. So when Ian was 16 months old, he had a port inserted in his chest, and he endured 8 months of IV chemotherapy and steroid treatments. He was off for 6 weeks, and he had a recurrence of the disease. So then he had 15 months of IV chemo, 2 types of oral chemo and steroids, and then he was off for 3 months, and he had a recurrence. And then he went through another year of chemo, and 2 types of IV chemo this time, and the steroids, which, if anybody's ever been on steroids, they're not a fun drug with a toddler, no less. After he finished that year, he had another relapse 7 weeks later, and he then underwent 6 months of chemotherapy. So with no other treatment alternatives besides chemo and steroids, every time he had a recurrence, they would up the intensity of the drug. and also the potential side effects from that drug. And each time he relapsed, he would have additional scans, so he had additional radiation. All of the things that you get when they're trying to determine if the disease has gone to his bone marrow, if it's gone into his brain, if it's gone into his soft tissue. So I'm an engineer, so I've dealt with this by enumerating things. So it's a crazy, it gives you a sense of control even though you really know there's no control in the situation. But in 4.5 years of this disease, Ian has had 129 IV chemotherapy treatments, 440 doses of oral chemo, 1,252 doses of steroids, 315 x-rays, 15 sedations, 10 MRIs, 7 bone scans, 6 CT scans, 5 PET scans. I bet you didn't know there were so many different types of scans. 3 surgeries, 2 bone marrow biopsies, 2 fluoroscopies, 1 just awful spinal tap, 22 ER visits, because anytime he would get a fever with a port, we'd have to go to the ER, 3 hospital stays, and literally thousands of doses of supporting drugs like antibiotics, anti-nausea medication, needle pokes, finger pokes, IV bags, urine tests, all that good stuff that comes along with being an oncology patient. And after all that, he still developed 3 new lesions after he finished his last chemo. And so 4.5 years into this, we really had no way of knowing how to stop this disease. And so we changed our mindset to thinking that it was a chronic condition that we would have to manage. And so when we dealt with the experts and we said, what do we do now? They said, let's give him a short break. And so we did that to give his body a break. And at that time, we scanned a couple months later and the lesions started to heal. So it makes no sense. You think, okay, was it the 4.5 years of chemo? Was it that he outgrew the disease? Was it a combination of these things? We don't know, and the experts don't know. And that's one of the frustrating things about a rare disease is that the established rules of the medical world just don't really apply. And you're kind of left to be an advocate yourself. Ian's doing great now, and we're very, very happy for that. But we do worry about the long-term side effects of all of the treatments and of all of the scans. And we're here today because we're forever changed by this disease. We host a hike every year where we raise money, and we will do that until there's a cure for this disease. So thank you so much for your time, and thank you to NORD for inviting us.
One story, and here comes another. A little less clear and understood, this story. I'd ask the speakers to try to keep on time. I do have a hard stop at 1 o'clock, so hopefully we can still make it to that. We do want to hear your story, cogently but clearly.
My name is Hanna Rapini. I'm from Springfield, Vermont, and I am Cole's mother. I'd like to begin by thanking Representatives Lance and Crowley for the opportunity to be here today and speak on behalf of my son and thousands of other Americans also suffering from undiagnosed conditions. On March 18, 2008, my son Cole was born, and despite being 5 weeks early, he received 9s on his APGAR scores and was deemed totally healthy by doctors. That is a word that I have not heard to describe my son since. In the last 3 years, I have left him on an operating table for 6 eye surgeries, an open renal biopsy, a supraglottoplasty to fix his airway, a feeding tube placement, and to have his adenoids removed. I've spent holidays in the hospital learning how to give my son steroid injections to treat a rare seizure disorder. I've sat in doctors' offices and been told that my son has lost half his hearing, that he might lose his vision, that he will likely need a kidney transplant, and among other things, that his brain is abnormal, but no one knows why. I've searched out doctors across the country who specialize in one of my son's symptoms and spent money I didn't have to fly him there. I've lived in hospitals for weeks at a time. I watched as my son was wheeled away for MRIs, spinal taps, skin and tissue biopsies. I've been told that my son may never sit unassisted, crawl, walk, or talk because everywhere we have been told that they have never seen anyone like Cole. Aside from the doctor's appointments, I have also battled with insurance companies that do not want to pay for his feeding tube or specialty equipment because my son is not diagnosed with a condition that requires the use of such things. I have picked out adapted strollers instead of bicycles and purchased every toy on the shelf, hoping that I'll find one bright enough for him to see or loud enough for him to hear. I've wondered if Cole is scared or if he resents me for putting him through all of the testing. I wonder if the smell of the EEG is just as familiar to him as it is to me. I've worried that he is mad at me for not being able to fix this for him, to make everything better for him like moms are supposed to do for their children. Last year, we were fortunate enough to be one of the very few applicants to take part in the National Institutes of Health's Undiagnosed Diseases program. They were not able to find a diagnosis for Cole, but perhaps in the future, they may find another patient who has similar symptoms and be able to find a diagnosis. Unfortunately, the National Institutes of Health is currently not accepting any more patients into this program because there are so many patients without a diagnosis and the resources for the program are limited. What is really needed is a way for doctors and scientists to be able to collaborate and to share information like a registry. Currently, cases without a diagnosis, like my son's, are left isolated and truly orphaned with no place to keep a record of his symptoms and medical history. Patients can only get on a registry with a diagnosis. So what do we do in the meantime? I can't read a book on his condition. I don't know what the best treatment options for him are. We only have our hope to keep us going, which that at times is hard to come by. While we are left hoping, Congress has the power to make a difference by ensuring that the National Institutes of Health has enough resources to continue and expand the Undiagnosed Disease Program. Congress can also help by creating a registry for undiagnosed disease patients like they have done for other diseases that could help foster research and collaboration with doctors throughout the country. Research that is needed to help find a diagnosis for Cole and the thousands of others without a diagnosis and without treatment. Thank you.
Thank you so much. This morning is talking about rare diseases and this one and that one and the 7,000, but we always have to remember that there's one more, and that's the one we don't know. We don't know what they are at all, and that's a large number. And thank you so much. Now we're going to hear from Ms. Alison Reynolds. Yes, already.
Hi there.
Listen for the words medical foods. Okay, this is a huge problem, an enormous problem. These are not like the foods. You'll hear about from that shortly. And Ms. Reynolds, why don't you go ahead and...
Hi there. Can everybody hear me? Okay, good. So I'm Alison Reynolds, and I'm here to talk about my daughter, Tia, who was diagnosed at 72 hours old with classical PKU. PKU, there are many different types of it, but classical is the most severe. About half of the people in the United States who have PKU have classical. So PKU was detected in Tia through the federally mandated newborn screening process. They test kids at about 48 hours old once they've been exposed to protein. PKU is a metabolic disease in where the body cannot process a part of protein. There are 20 amino acids in a protein, and her body can tolerate 19 of them, but one of them is quite toxic to her body and her central nervous system. Over time, if she was exposed to phenylalanine, we call it Phe, her executive functions would break down, her brain would sort of essentially wither away, her IQ would go down, and in worst cases, some of these people suffering from PKU are institutionalized. So in order to remain healthy, Tia and others with PKU are limited to a highly restrictive, often unpalatable, low-protein diet. She has to consume a medical formula every day for the rest of her life. We had never heard of PKU when she was diagnosed. Many people have never heard of it. We have yet to find a pediatrician who's ever treated a kid all year round with PKU. She's the only person living with it in Washington, D.C. today. We're local. And there are 15,000 people in the United States with it today. It's an incidence of about 1 in 15,000. PKU is a very tough disease. It's very isolating. Tia's daily struggle has to do with not being able to have what they serve in the lunchroom, birthday parties. It makes children feel quite different, and it's tough. The formula that I mentioned before is a big part of treatment. PKU is unique. Doctors often talk about this. It's treated through diet and formula. And so it means that every day she drinks the formula, she follows a very restricted diet, and she gets 80% of her nutrition from this formula. So you can imagine she has a plate that has a few fruits and vegetables on it, and then she drinks the formula. The formula fills her up, so she won't be tempted to eat other foods that are outside of her diet. So what makes PKU tough for a lot of families is the treatment, the food, and the formula is very expensive, and it's often not covered by insurance. It becomes a big burden for a lot of families. There's a listserv for PKU families across the United States, and we talk about recipes and how to, create a meal that may be palatable for these children and adults. And you hear awful stories about people having to move states, sell their homes, sell their cars. This is, I have some of her food up here. This box of rice, this is specially engineered low-protein food, costs $9.25. We spend $500 on average a month on Tia's food. This is on top of her other groceries, the fruits and vegetables that she eats. It's shocking. A loaf of bread is $12. A row of, the log sort of the chocolate chip cookie dough that's low protein is $20. This is her formula. So she drinks 3 packets a day. This one packet is $40. So we spend $120 a day on her formula. So each month it's $3,500. Now we have insurance. We're one of the lucky few in the United States to have insurance. And there's an issue though. Our insurance company, they've covered 20 to 100% on and off over the last 6 years. And they've written in the letter to us saying, you have, we'll cover her formula, but they say there's no guarantee. So several times a year, I get a phone call from her formula provider saying, I'm sorry, we can't ship your daughter's formula tomorrow because there's a $17,000 balance on your account. And so I struggle through the appeals process with our insurance company many times every year, and it's really difficult. And they always fall back on we said in the letter there's no guarantee. And so it's a really, really big struggle. It takes hours a day to manage PKU, and often these families are met with having to make these phone calls. It's really, really tough. So I just wanted to point out in summary that newborn screening is federally mandated, but the treatment is not. So the government, does the testing, they present you with this lifelong battle, and then they walk away. So the logic is lost. It makes no sense. And the math works. If you pay for treatment up front, these children are healthy, they're thriving, Tia is normal, she's doing beautifully. But if you don't treat, they'll be institutionalized in the state, and the government has to pay a tremendous amount for that. So that's the big takeaway.